Good afternoon, everyone. It's 2 o'clock. Thanks for joining us. Time to begin today's briefing. Joining us today are Milwaukee Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services, the Office of Emergency Management, Marlena Jackson, Interim Commissioner of the City of Milwaukee Health Department, Darren Roush, Health Officer and Director of the Greenfield Health Department, and Cheryl Isabel, Outreach and Enrollment Specialist with the Milwaukee Health Services Incorporated. Mayor Barrett, we'll start with you.
Well, thank you very much, Sydney, and good afternoon, everyone. I want to begin by giving a huge thank you to our Election Commissioner, Executive Director Claire Udo-Vogt, her staff, and all of our election workers and volunteers. It was an amazing job that they did, not only on Tuesday, but in the count into the wee hours of Wednesday, as well as the lead up with the 10 days of early voting. So I'm grateful to everyone who worked around the clock Tuesday and deep into Wednesday morning to get our ballots processed as quickly as they did for the 2020 general election. I have to say Claire and her staff also put in a lot of hard work during the months leading up to the election to prepare for a safe election for all our residents, despite the ongoing COVID-19 pandemic. And so you can see what the advantage is when you've got a little lead time, which we did when you compare it to what happened in April as to what happened in November. We had additional resources. We're very thankful for that. And as I've said many, many times, it was really a marriage between our election commission and our health department. And for those of you who voted in person on Tuesday, you saw that. You saw the plexiglass, you saw the masks, you saw all the work that was being done to make it very, very, very safe. I'm pleased we were able to have over 170 neighborhood-based polling locations open. It was a bonus to have the weather that was on our side with a warm and sunny day. That was actually beautiful to have, and we're going to enjoy that for the rest of the week. So I want to thanks to everyone who took part in our democracy by voting absentee by mail, in person, or on election day. Your vote is your voice, and I think we're witnessing that right now as we come to the conclusion of this 2020 election. At least I hope it's a conclusion of the 2020 election. Now for some update. Amazing turnout yesterday also for our testing sites. I think it was our largest testing site day. Keep in mind that the testing was closed on election day at the Northwest and Southside Health Centers, but yesterday we had 2,354 people at Miller Park. Northwest Health Center, which serves obviously the whole area as well, but the northwest part of the city of Milwaukee, 638 individuals. We had 466 individuals on the Southside Health Center. At the South Shore, which is the Zone E in South Milwaukee, there were 547. So we cracked 4,000 among these sites to bring our Milwaukee total this week to 10,569. So a lot of people are getting tested. Dr. Weston's going to talk about that's the good news. The good news is people are getting tested. Dr. Weston is going to talk about the challenges we have with positivity rate, which is a major concern of mine, a major concern, I think, of everyone who's following this closely. And to try to address some of these issues, earlier today, the Milwaukee Health Department and 16th Street Community Health Centers for a webinar to provide critical COVID-19 information to our Hispanic community leaders. Dr. Weston was part of that call as well. And it really is, I think, a demonstration of how much work still needs to be done. As Dr. Weston will tell you, we're seeing pockets of continuing hot activity on the south side in the city of Milwaukee and the north side in the city of Milwaukee. And there are a lot of factors that play into this. There's a lot more density there. There's a lot more essential workers in these parts of the city. But we are very, very concerned about these numbers. And we know that people are frustrated. We know that there's a lot of frustration because people want to get life back to normal. So as we've tried to, we try to take the health concerns first and foremost. At the same time, we recognize that there are small businesses, there are people who work for small businesses who have to continue to go to work. That they, as we talked about, Dr. Schuler talked about this in our webinar this morning. What do you do for the mother who has to make the decision between caring for her kids or going to work? These are real world issues that we're grappling with right now. But we also realize that people have a need to be social and to go out. And that's why our Active Streets program is so important and why we've got a winter extension for our Active Streets for Business. The city's Active Streets for Business program that launched this summer permits restaurants, bars to utilize sidewalks, parking lanes, and travel lanes for expanded sitting accommodations. And you probably have seen this in different parts of the city, where all of a sudden you're seeing tables on the sidewalk or tables in the street. But since the beginning of this program, we've been working with businesses throughout the city to ensure that they can serve their customers in a manner that's both safe and enjoyable for the patrons. We have heard overwhelmingly from the business community the desire to continue expanded outdoor seating even through the winter months. I think all of us, when you want to get out of our house and you want to do something, you really have to do it in a safe way. So this no-fee citywide program has proven popular with 42 bars and restaurants who currently participate in the program. And we're certainly open to have more bars and restaurants participate. So based on this feedback, we will extend the program until March 15th, 2021. We've consulted with the Milwaukee Health Department's Moving Milwaukee Forward guidelines and the business community to balance out the needs of our businesses and the public at large. The revised guidelines now allow for tenting and heating, given certain requirements. Businesses will also need inclement weather plans submitted for snow and ice removal. So we're in Wisconsin, we know winter's coming, but we're going to take this challenge and try to make sure that we can continue to provide service for people, employment for people, but do so in an incredibly safe way. Applications and guidelines for the program are available online at milwaukee.gov/DPW. Current participants in the program will still need to apply for the winter extension. So if you're associated with one of these places, you obviously are also going to have to adhere to the revised guidelines. I also want to point out, as I did last week, that the ACA, the Affordable Care Act, open enrollment period has begun. It began on November 1st, and it's going to go through December 15th. And you can call 211. That would be the number I would call. I would call 211 or go online to healthcare.gov or whizcovered.com to sign up. So again, you've got basically 5 weeks to do this, so please take advantage of that. You'll hear more about it because on today's call, we are joined by Cheryl Isabel, who's an outreach and enrollment specialist with Milwaukee Health Services. She'll be sharing more information about open enrollment for viewers later on in this call. So I appreciate everybody staying with us. We've got a lot of work to do, but let's keep working. Back to you, Sydney.
Thank you, Mayor Barrett. Up next is County Executive David Crowley.
Thank you, Sydney. Thank you, Sydney, and thank you, Mayor Barrett. I first want to start off by recognizing the Milwaukee County Election Commission, our County Clerk, George Christensen, as well as our Director of our Election Commission, Julietta Henry, for the tremendous work that they did. I mean, they've collaborated with local municipalities to ensure that each of the nearly 500,000 votes that was cast into Tuesday's elections was counted. And we wouldn't have been successful in holding Tuesday's election without the hard work and dedication of election officials, poll workers, and volunteers. In the midst of this pandemic, these folks have worked tirelessly to ensure voting in Milwaukee County was not only safe, but fair and accessible to everyone. I also want to thank county residents for showing up and making their voice heard. I'm inspired by the high turnout in Milwaukee County across mail-in, early, and in-person ballots. Our focus on achieving racial equity hinges in part on the inclusion of all voices, especially those who have been historically marginalized economically, politically, and culturally. More people exercising their right to vote is a testament to the level of engagement across the county and across the political spectrum. It's a testament to those who have helped ensure that COVID-19, this pandemic, doesn't obstruct democracy. Those election officials, those poll workers and volunteers are the true heroes of the election process, and we are forever grateful for this tireless work. So I want to switch gears a little bit. We want to make sure that all Milwaukee County families and homes are safe and warm this winter. The Wisconsin Home Energy Assistance Program helps qualified county residents afford their heating and electric bills. And if you're worried about being able to pay your energy bill, now is the time to apply for Milwaukee County's energy assistance. The income requirement have changed because of the pandemic. So even if you've previously applied and didn't qualify, I highly encourage you to apply again. And you can visit keepwarmmke.org for more information or to apply online. But when you qualify for the Energy Assistance Program, you can also access additional energy saving and money saving programs. And these programs include furnace repair or replacement, which will help with an excessive energy burden, the emergency crisis service and prevention crisis assistance. With the weather turning colder soon, and I know it doesn't feel like that with this week, it is important to have a plan in place with the energy assistance team to prevent disconnection. So if you could benefit from this program, I highly encourage you to schedule an appointment today or apply. Again, visit keepwarmmke.org for more information. I want to make sure everybody has access to the great benefits so all of our residents are safe and warm this winter. Finally, as the mayor mentioned, enrollment for the Affordable Care Act 2021 health insurance is now open. And as Milwaukee County continues to invest in improving our health outcomes on its mission to become, and on our mission to become the healthiest county in Wisconsin, it is critically important that each county resident has health coverage. We want to make sure all county residents have the coverage that they need to live stronger, fuller, and healthier lives. And with that, I'd like to turn it over to Dr. Weston.
All right, good afternoon. Thank you, Mr. County Executive. First to our numbers, we have 45,729 confirmed cases of COVID-19 in our community and 497 individuals who have died. I just want to put out a quick reminder. Next week, our South Shore testing site will be closed for Veterans Day. So we'll give another reminder on that next week. We've all undoubtedly been following and continue to follow the election results as they come in. But despite Election Day having passed, COVID rages on stronger than ever in Wisconsin as well as Milwaukee County. Just this last Tuesday, we saw the highest single day increase in hospitalizations of COVID patients, both in Wisconsin as well as in Milwaukee County. In the county, we now have 418 people hospitalized with COVID-19. For comparison, we barely crossed 200 hospitalizations at any other point earlier in the pandemic. I've stated multiple times on this briefing that with all the planning that we put in place in the spring among our health systems, that Milwaukee County hospitals were as well positioned as they could be for this surge. And that's still true, but no matter how well positioned and how well prepared our hospitals are, no health system, no hospital can keep up if the numbers continue to rise at as fast a rate and frankly, as accelerating a rate as we're now seeing. Not only do we not have a flattening of the curve, but we have quite the opposite. We're seeing a steepening of the curve as our numbers are getting worse and worse. So that leads to what can we do? We've certainly hammered home the safety precautions and testing indications. So today I want to focus on a few items that I think are sometimes misunderstood. First, how to use personal protections. We must remember that each part of personal protection, so that's masking, physical distancing, being out in the open air, shortened time of exposure. These are layers of precaution. These layers are not nearly as effective when used individually as they are when used in combination, where we really get a multiplicative effect. Second, the discussion around gatherings. There's a lot of attention around large gatherings. We all know, for example, an indoor wedding with 100 people, it's a bad idea. But for each of these large gathering events, there's many more small gatherings with friends, with neighbors, with extended families, 8 at a time, 10 at a time, 12 at a time. And those can add up to be just as dangerous, just as problematic, with even more collective transmission than those single large events. Unfortunately, this is a time when we must be avoiding both large as well as small, indoor, non-distance gatherings among family or friends. Third, there's confusion over the 2-week quarantine period. So if you have an exposure, you have to quarantine for 2 weeks, period. Unfortunately, you cannot test your way out of a quarantine. A negative test 5 days after an exposure does not mean that you won't become contagious and you won't develop symptoms on day 10 or day 14. Fourth, and finally, if you do get tested after a concern for an exposure, what's the best time to get tested? The day after an exposure? So if you're exposed, you think on Sunday, is probably not the best day to get tested. You're very unlikely to test positive. Typically, after contracting disease through an exposure, you test positive after, on average, about 5 days. But this can be as late as 14 days, hence the need to quarantine. So please keep these principles in mind. We want to flatten the curve. But before we can even start thinking about flattening curve, we have to slow the steepening of the curve that we're seeing right now. And that can only happen if we carefully consider safe individual decisions. There's certainly an end to all this, but it's not here. And honestly, it's not looking close. For now, we must all buckle down, keep our community as healthy as possible. Thank you and stay safe. And I'll pass it along to Commissioner Jackson.
Thank you, Dr. Weston. So I'm going to talk a little bit today about our testing at our community sites, and then also talk a little bit about our flu clinics that will be available starting next week. So first, in regards to our Milwaukee Health Department testing sites, as the mayor had already shared earlier today, the exact numbers, but I want to make sure that everyone understands that those 3 sites at this point are exceeding capacity every single day, which is a great thing. But I want the general public to understand that that capacity, we're talking 50 to 100% over what those sites were generally built for. And so I want to thank all of the individuals that are working those sites, that are putting themselves at risk, that are working in the cold to make sure that we do have testing for our community, but know that the sites were built for particular numbers of capacity. And there are times within the week, particularly on Mondays, when we are over that capacity to a level where those sites potentially need to close early. When that happens, I know there's lots of communication out there about maybe it's best based off of testing availability or test supplies. And most of the time it is not that case. We have tests available, we have staffing. It's a matter of getting the sheer volume through in a time where we can get our staff home at a reasonable hour, knowing that they have to be back the next morning to test. So people who are seeking tests have many options outside of the 3 Milwaukee Health Department sites. We're first asking that if you have a primary care provider that you are experiencing symptoms or have been exposed, that you contact them first. There are other opportunities to get those tests. In addition to that, the federally qualified health centers are another option for free testing. If you need more information, you can go to both the health department, the City of Milwaukee Health Department website, coronavirus testing, as well as the Test Up Milwaukee site for even more opportunities for testing, as well as times and availability. So I want to highlight too the partnership with the National Guard, particularly at Miller Park. We would not be able to have tested the number of tests that we have. We would not be able to have had such a smooth transition without the support and the help of the National Guard. So I want to just take an opportunity to thank them. And lastly, we know that a lot of individuals that are coming to the sites, to the 3 sites to be tested, are coming because they believe they might have been exposed to COVID-19. And while we're not discouraging people from getting tested, we want people to avoid groups and settings that might expose them. So this is about making sure that you are avoiding places, avoiding situations, and avoiding behaviors that expose you to increased risks of contracting COVID-19. So also wanting to just share, as Dr. Weston has also shared, if you do believe that you have been exposed to testing, whether it be over the weekend, know that there is generally that 3 to 5 day exposure timeframe when we would want you to ideally get tested, knowing that for that full 14-day period, there's opportunities for you to be exposed, for you to have symptoms as well as be contagious. So next, I want to move on to our flu clinics that are also located at the 3 Milwaukee Health Department sites. So you might be aware that the Southside Health Center, the Northwest Health Center, as well as Miller Park are offering flu clinics, just the 2 sites, the Southside and Northwest, are offering flu clinics. But we have had an opportunity to partner with Children's Hospital as well as Milwaukee Public Schools to provide free flu clinics starting next week, November 9th. And what will happen is that the Milwaukee Health Department will be providing the flu immunizations that will be administered by Children's Hospital of Wisconsin nurses, as well as Children's Community Plan nurses. Know that flu immunizations are always a good idea, and in particularly this year with the COVID-19 pandemic, it's even more important. So these 4 clinics will be open from 10 a.m. until 2:30 p.m. The locations change each day. So there are 4 total sites available for clinics: Monday, Tuesday, Wednesday, and Thursday, again, 10 a.m. to 2:30. On Monday, this November 9th, the flu clinics will be at Andrew S. Douglas Middle School off of 3620 North 18th Street. On Tuesday, November 10th, it'll be at Anna Doeffler Elementary School at 3014 West Scott. Wednesday, November 11th, at Engelbert Elementary School on 5100 North 91st Street. And on Thursday, November 12th, at Zablocki Community School, 1016 West Oklahoma. Again, want to just highlight that this is really, it shows the collaboration that has been happening since the beginning of this pandemic that is absolutely necessary to continue to work together to try to fight this virus, fight it together as a community, individuals, and organizations. So we hope that everyone gets their flu shot this year, as it will be helpful in battling COVID-19. And with that, I will transition it over to Darren.
Thank you very much, Commissioner Jackson. My name is Darren Roush with the City of Greenfield Health Department, and it's my pleasure to join today to talk through some of the data key points here in Milwaukee County related to COVID-19. Before I get into the data, I want to start talking about some of the several overarching issues that we've seen and we will see in the data momentarily. And these are echoed by many of the speakers that have preceded me today as well. First, we are continuing to see a very sharp increasing trend of disease in this most significant period of COVID-19. No matter how we slice the data, we continue to see higher and higher numbers week over week over week. The city of Milwaukee is currently experiencing 7-day averages in cases that are nearly double their previous high in May. And the suburban communities are currently experiencing 7-day averages that are nearly 2.5 times higher than the suburban communities experienced in mid-July. We can continue to see sharp increases in both the children as well as our whole entire population. Secondly, I want to point out that there's several indicators that will reflect in the data today that are really trending in the wrong direction and starting to reflect that very serious nature of the COVID-19 pandemic. We continue to track hospitalization rates amongst those who are 80 plus years old that are on a sharp increasing trend since early October. Secondly, we're seeing a lot more deaths. We're seeing deaths increasing, specifically with a notable increase in the suburban communities that appears to be primarily amongst the older, more vulnerable population. And lastly, we've tracked increases in hospitalizations, which also have the ability to significantly impact our healthcare capacity within the county and the region. Lastly, I'll mention that the utilization of testing has increased for 7 straight weeks and has surpassed the earlier key point in testing in early July, where we were previously at our highest. But note that this increase in testing does not explain the increase in cases. The COVID-19 case numbers are increasing due to sustained community-wide transmission of COVID-19 throughout Milwaukee County. And this is a narrative that's seen throughout Wisconsin and other parts of the state as well. Lastly, the increasing case numbers are severely straining local public health resources. And further, these increases have caused a significant prioritization of disease investigation, severely limiting contact tracing, and have the potential to add further strain on healthcare and healthcare capacity. So let's go ahead and look at the data real quick in the next couple moments. What's on the screen here on the left, I have the current graph that shows new cases of COVID-19 in the entire population. And on the right side of the screen, I'm showing 2 graphs that look at at the population of children, whether it's 18 or under at the top or 17 and under on the bottom. And the key point I want to show here in all three figures is that the trends are increasing amongst both the kids and the adults. This is no longer a disease that's just circulating in adults. We've known for weeks that the rates of disease are increasing in the child population. So now focusing specifically just on the whole population, we continue to talk about deaths. And I mentioned previously that we're seeing a slight increase, and that's been something that we've been carefully watching for the last several weeks. I reflect here for the first week that we've seen this is an increasing spike in deaths in the suburban communities. So the average has increased over the last couple weeks in the suburban communities, which bears careful notice, and we need to continue to monitor that. Our concern is that the death rates could start to increase again in our older, more vulnerable populations, much like they did back in March and April. Next, I'll talk about the COVID transmission rate, or the reproductive number. We have seen, unfortunately, very much so since the end of August, early part of September, that transmission rate has been largely above 1, which means there's continued sustained transmission of COVID-19 from one positive case to others. And when we drill down a little bit further and look at this particular graphic by city and compare the city of Milwaukee to the suburban communities, we see, in fact, things are looking a little bit worse for that transmission rate in the suburban communities as compared to the city of Milwaukee. We continue to track all of the demographic patterns, and I will certainly highlight a few things. We certainly continue to see our greatest numbers in those young adults, the 25 to 39-year-olds. We continue to see very much increasing trends in that population as evidenced here. Sharp increases across all population groups, but that population group is leading the way in terms of cases. We know that the rates in the Hispanic and Latinx community are much greater than in any other population subgroup, yet our white population data is leading in terms of raw cases. I mentioned that hospitalizations have been concerning, particularly amongst the older folks in our community. And we see here this very sharp increase in hospitalizations that's really been seen since the early part of October among those individuals 80 plus, and a slighter but still significant increase amongst the next lowest age group, the 60 to 79-year-olds. I want to talk next about testing. I did indicate that testing is increasing, and it's very, very good to see that testing utilization is increasing. Again, data continues to pend for the most recent week, and we expect that number will increase dramatically as those results come in over the next several days. But we're seeing, unfortunately, trending in the wrong direction. We're seeing a statistically significant positive trend in percent positivity, and that's something that we're very concerned with. But testing is available, as you've heard others say. Testing is available, but it's at capacity in many cases, and these sites are having to close down. So continue to look for other opportunities and other avenues to get testing as we work to increase the testing that we can do in the community sites. Lastly, I'll reflect on what's been happening in the most recent week. This particular graphic shows confirmed cases of COVID within the last week, looking at a time period from October 28th through November 3rd. And we see a widespread cases across Milwaukee County, particularly the southern side of Milwaukee City, as well as the southern and western suburbs. And so there's a lot of disease activity in those areas, and we need to make sure that people who are symptomatic are getting the testing they need. Another way of looking at this map is to see who's accessing testing. And unfortunately, we continue to call out there are places that are being under-tested. So certainly, if you have symptoms, if you have concerns about being exposed, or you would like to get tested, certainly do your best to find that testing wherever you can in the community. We need to do whatever we can to get testing, to get people identified, isolate, quarantine, and do all of the things we need to do to suppress disease. So in conclusion today, the data continues to show that we're heading in the wrong direction and heading to levels that we just can't simply comprehend, quite frankly. We all need to do our part to limit transmission. Thank you for your time and attention, and I'll now turn the briefing over to Cheryl Isabel from Milwaukee Health Services. Thank you very much.
Thank you, Director Roche. On behalf of the more than 100 enrollment experts serving the Milwaukee community, many thanks to the mayor and county executive for your leadership and reminding the public about this important enrollment period. This year, more than ever, we know how important it is for folks to have access to affordable healthcare coverage, especially with so many facing job loss or furloughs due to the pandemic. And this afternoon, I just want to talk a little bit about the open enrollment period and the Affordable Care Act. The open enrollment period ends December 15th. People need to sign up by the deadline for health insurance coverage in 2021. The Affordable Care Act, which is still in effect, provides access to many essential benefits, and the ACA offers financial assistance to help lower monthly premiums. In fact, 8 out of 10 individuals in Milwaukee County who get their insurance through healthcare.gov receive support for low costs and sometimes free coverage. Although laid off workers often have the choice of extending their health insurance through COBRA coverage, it may be a more costly solution. Enrollment experts can help individuals compare their potential COBRA costs, such as premiums and deductibles, to similar plans on healthcare.gov or through Badger Care Plus. An enrollment assister like me can help someone who's lost their coverage take a look at a bigger picture of their reduced household income and health insurance options. It's important to learn about alternatives before signing up for COBRA, and that's what we want to stress to the consumers. Now, next I want to talk a little bit about what people need to know how to enroll in the ACA or marketplace coverage. We suggest consumers be prepared when signing up for health coverage through healthcare.gov or when working with an enrollment assister to help them determine their eligibility for financial assistance. They should have information already about their household income, as well as information about who in their household needs coverage, and to help them find the best plan, the names of their doctors and clinics and prescriptions. The next thing I want to talk about is what benefits are available. The benefits to enrolling in marketplace in coverage or Obamacare is you have access to all the medical essential benefits, seeing your primary care doctor, seeing a specialist. You have access to your medications, access to mental health care, and substance abuse disorders. For people that want more information about how to enroll, where to go, it's easy to get connected to an enrollment expert for free help to find a plan or more information. Just call 211 or go to a new website that is very user-friendly. It's wiscovered.com for more information. And that's spelled WISCOVERED.com. And that's for more information. Thank you.
Thank you, Cheryl. Our first question from the media comes from Dan Malloy at Spectrum News 1 for Dr. Weston and Director Rausch. When it comes to COVID-19 messaging from health officials, what seems to be working and what is not? What might need to change as fall turns into winter?
So that's a great question. In my briefing, I outlined a few things that I think are not working. So that was the understanding of sort of the layers of protection, I think has been confusing. I think the idea that small gatherings can be just as bad as large gatherings, especially when combined or when happening often. The confusion over quarantine and the confusion over when to get tested. I think another item that's important is just the idea, we're seeing it around us. We're heading into colder weather, the fall, the winter. There is an end in sight to this. We won't be doing this forever. We won't be physically distancing forever, but we will be for the next few months. We will be for the fall. We will be for the winter. Even if a vaccine comes out toward the end of the year or the beginning of next year, it's going to take time to distribute. It's going to take time to manufacture. So unfortunately, this is going to be a winter that's different from past winters. It's going to be, we'll talk about this in the future, but it's going to be a Thanksgiving. It's going to be, the winter holidays are going to be different from what we are used to. You know, on an individual level, on a group level, I think the you know, mentality of how vigilant we are, how careful we are with events is going to have to stay in place for several months to come.
Our next question comes from Sari Lesk at the Milwaukee Business Journal. Last week's business update did not include any new approvals for safety plans. What is the status of this program and why weren't any additional plans approved last week? Also, how does the city evaluate whether this program is having its intended effect?
So our current numbers, we have 616 plans approved. I'm not sure, we are continuing to review and approve those plans. I'm not sure if maybe that question is specifically related to schools. Maybe we had not had any additional school plans come in last week. And then additionally, in regards to those plans that are being approved, we do have teams that go out to do site checks for all of our restaurants for compliance. So that happens during the weekend as well, during the weekends as well.
Thank you, Commissioner Jackson. Our next question comes from Sharon Bajenda at CBS 58 for Mayor Barrett and Commissioner Jackson. Did you see compliance from bars during Halloween weekend? Were any bars issued citations?
So we did have teams that went out this past weekend over the holiday weekend, and I will share that we did see both compliance and non-compliance. So I want to thank the establishments that absolutely are following their plan, respecting social distancing, respecting masks, but we did also see non-compliance, and we continue to get reports and complaints regarding particular establishments that are non-compliant. So we will continue to do that work around enforcement and making sure that we have enough staff to make sure that we can consistently look at compliance across that particular sector. I don't know if you have more to add, Mayor.
I think you covered it. I think you got it. Let me just say, we are going to continue to look at our level of fines also to determine whether they serve as an adequate deterrent. We're hearing reports that some establishments might decide that the fines are worth it. Again, as the commissioner has repeatedly said, our whole plan is not to be punitive. It's to be really proactive in trying to make this a healthier city. And so if we're finding that people build into their business decisions that they're just going to flaunt the law, and Dr. Weston was talking about larger events and smaller events, that's when we're going to start taking action again.
Our next question from Sharon Bajenda is for Dr. Weston and Darren Rausch. Learning from past holidays, do we expect to see a jump in cases from Halloween weekend? Also, are rapid tests becoming more popular? Will we see them more and more, and how accurate are they?
So I can start here. So as far as expect to see a jump in cases from Halloween weekend, I mean, we know that COVID is spread by close contact. And so as careful as people are over Halloween, obviously some people were more careful than others. So I would say some sort of increase would be expected. Now, we're seeing a pretty extreme surge right now in cases and hospitalizations, increasingly in deaths. So I'm not sure how much worse that surge can be, but we'll continue to watch it and monitor it and report on it. As far as the tests, we have a testing work group that's cross-collaborative across the county that's working with the state on rapid tests, both the rapid PCR tests which are the kind of standard tests, as well as the rapid antigen tests that look more at the structure of the virus. Both of those are being reviewed and implemented on some levels.
Our next question comes from Madeline Anderson at Fox 6. My question is for either Commissioner Jackson or Dr. Weston. Are you investigating an increase in cases on either or both the Marquette or UWM campuses? The Marquette COVID-19 dashboard shows the 7-day average has reached a record high this week, and MU recorded its highest single-day count on Tuesday. What do you believe is contributing to the increase in cases on college campuses?
So I can start and share that the Milwaukee Health Department is in regular communication with our colleges and universities. So we work very closely to monitor their overall positivity rates and talk about mitigation. So overall, I would say that we are aware and working with them to identify those particular behaviors or those particular areas, for example, a dorm or something like that, to try to add to mitigation. And so that would be my general response to that. I don't know if you have anything else, Dr. Weston.
No, I think that was a good summary.
Our next question is from Rebecca Clough at TMJ4. For Dr. Weston, we've seen northern and western parts of the state max out their hospitals. How close are we doing that to here in Milwaukee?
Yeah, so when we look at Milwaukee County, we can see it on our dashboard. There is still room for floor beds. There is still room for ICU beds. There's plenty of room for ventilators. But what's important to keep in mind with that data is it's the average over our county, the average over many different hospitals. Obviously, different hospitals are in different positions. Nobody is at the point where they can't take any patients. But I think the concern that we're seeing is even with all the preparation that went into it, when that curve is not just a straight line, it's actually a line that's continuing to go upward. It's hard for any hospitals to keep up with that. And so if that trend continues, I can't imagine that a hospital in Milwaukee County, a hospital in New York City, a hospital in Chicago, and no hospital can keep up with just unending increases in hospitalizations.
Our next question is from Sari Lusk at the Milwaukee Business Journal. The health department has shared that it sends teams out to check on restaurants and bars for compliance. But how does the department evaluate whether having this program is preventing the spread of COVID-19?
So we do that two ways. Number one, we do use our contact tracing basic public health exercises to do that. We speak with individuals who are testing positive, and through that investigation and that interview process, we understand who and where individuals have been or have potentially been exposed. So that's one method that we use to evaluate. But just as Dr. Weston just shared in regards to capacity, as our numbers go up overall through the city, and as Darren had also shared, we have to prioritize, we are forced to prioritize which interviews we're doing and how in-depth those interviews are. So the increase in volume does decrease our opportunity to catch as much information as we can through our contact tracing process.
Thank you, Commissioner Jackson. Our next question is from Taryn Powell at WUWM. For clarification, is testing at or near capacity or not? Or were there just concerns at specific sites?
So our the three health department sites have exceeded capacity. So the the Miller Park site was originally designed to do 1,500 to 200 tests. They are, 1,500 to 2,000 tests. And we are regularly averaging around 2,300. So about 300 or more over what the capacity there is. Additionally, at Northwest Health Center as Southside, those two sites were designed for around 400 tests. And we again average above 400 for the last week easily. So they are both over capacity. With that being said, I will tell you that that we are testing way above that. So we are having individuals come and we are testing them. It does get to a point where if the lines are just too long, again, based on being able to get our staff home so that they can be back the next morning, we have to make a decision to close or to stop that line from forming. So that has happened. Additionally, though, I would share that what we want to make sure, and that's why I spent some time today talking about when should you get tested. So if you're exposed, it's a 3 to 5 day general time when you should go to get tested. Additionally, make sure that if you have other opportunities or other spaces where you can get tested, whether it's your primary care doctor, whether it's using the federally qualified health centers, that there are other opportunities. Our service is free and it's no appointment. So there are absolutely times when there will be wait times. There are absolutely times when again, when it exceeds the 2,000 for the day, that we have to stop the line. With that being said, we are continuously working to find other opportunities. So we're looking at mobile sites to be opened up. We are constantly looking at ways to increase that capacity, knowing that the demand is there.
It looks like that might be our final question. Are there any other questions from the media? All right, thank you for your time, everyone. We will see you back here next Tuesday.
Thanks, everyone.
Thank you.